Assalamu alaikum. We are going to study about the arteries of the pelvis. This is abdominal aorta. Abdominal aorta at the level of L4 and L5 gives rise to the two common iliac arteries. Right common iliac arteries, left common iliac artery. Left common iliac artery, both common iliac arteries goes till the sacroiliac joint. At the level of sacroiliac joint, common iliac artery of both sides give rise to the internal iliac artery and the external iliac artery. External iliac artery passes behind the inguinal ligament and enters the thigh to supply the lower limb. This internal iliac artery at the level of greater sciatic notch divides into two branches, posterior division and anterior division. Posterior division of the internal iliac artery gives the iliolumbar artery, lateral sacral artery, and continues as the superior gluteal artery. This anterior division gives rise to one branch, umbilical artery. Umbilical artery, this is the patent part of the umbilical artery. If we follow it, then this is the occluded part of the umbilical artery. Occluded part of the umbilical artery is the medial umbilical ligament. If we see the embryological remnants of the umbilical artery, then this is the medial umbilical ligament. And this umbilical artery also gives rise to the superior vesical arteries. Then the second branch is obturator artery. Third branch is uterine artery and the vaginal artery. Then it gives one branch that divides into further two. This is the middle rectal artery and this is the inferior vesical artery. If we see that superior vesical arteries was originating from the umbilical artery and the inferior vesical artery arises directly from the internal iliac artery. Then anterior division of the internal iliac artery finally divides into its two terminal branches. First terminal branch is internal pudendal artery and the second one is the inferior gluteal artery. Inferior gluteal artery is the largest terminal branch of the internal iliac artery. Internal pudendal artery then give rise to the inferior rectal artery. Middle rectal artery was originating from the main internal iliac artery. मतलब we are studying anterior division, तो mainly वो anterior division of internal iliac artery से middle rectal artery आ रही थी. और inferior rectal artery arises from the internal pudendal artery, and internal pudendal artery also gives perineal branch that supply the perineum of the female or male. Or inferior gluteal artery supply the gluteal region of the body. Superior was originating from the posterior division of the internal iliac artery, or inferior gluteal artery is the terminal branch of anterior division of the internal iliac artery. So we have completed umbilical artery. Umbilical artery gives rise to the superior vesical artery, and its occluded part gives rise to the medial umbilical ligament, and it also gives rise to the superior vesical artery. Second branch was obturator artery. Third, uterine artery, vaginal artery. This is inferior vesical artery. This is middle rectal artery. These are two terminal branches, inferior gluteal